Welcome to Labor's View. This show is brought to you by the very hardworking and dedicated employees of the Essex County Division of Welfare. They are the non-supervisory employees, and they are also members of the Communications Workers of America, known as CWA, and our local is number 1081. I'm David Weiner, president of the local and host of Labor's View. Our guest today is India Hayes Larrier, and she is a coordinator with New Jersey Citizen Action. And I'll ask her a little bit of background, but what's that term they use? There's a term when you're supposed to give background information. Well, I co-chair the board of New Jersey Citizen Action. What's that term that they always
full
use?
Disclosure.
Full disclosure.
In the interest of full
disclosure. In the interest of full
yeah.
disclosure. Yeah. Steve Addabad does that so well. So, welcome, India.
Thank you.
So, please tell us about yourself.
Well, my name is India Hayes Larrier, and I am an organizer with New Jersey Citizen Action. And New Jersey Citizen Action is the largest independent watchdog coalition in New Jersey. And we have about 60,000 members, 100 affiliates, and we work on issues regarding fairness and social justice, and that includes healthcare, which we're here to talk to today, as well as fair and affordable housing. We also do free tax preparations. We were very instrumental in helping with the Affordable Care Act, otherwise known as Obamacare, the registration for people to get signed up for that. So we're very active.
For the exchanges in particular.
For the exchanges,
right.
yes.
Right.
So we are very active in New Jersey, and we're always trying to be right on top of things.
And I think you and we are. Today we want to talk about the situation of the, generally speaking, privatization of, I guess you'd refer them as public hospitals or nonprofit hospitals. What's the differentiation, if there is any?
Well, ideally, what we say is not necessarily privatization. We say community not-for-profit hospitals being transferred to private, or more accurate, for-profit organizations. And these sales or transfers are happening pretty much all over New Jersey. What happens when a not-for-profit hospital is transferred, or rather sold to a for-profit hospital, a hospital company, we have seen in the past with many of these sales that some very basic issues come up in the hospitals that are sold.
And those are?
Well, there's a long list. I will go over some of the most prevalent. Many of these hospitals become what we call out-of-network hospitals, meaning that they do not accept insurance coverages. They are, because they're out-of-network, insurances will pay at a lower rate, and because they're out-of-network, they are legally allowed to balance bill their patients.
For explanation, when you say network, I understand it to be, let's say you have an Aetna or a Blue Cross, for whom you used to work, Horizon.
I did used to work for Horizon,
so you were in the
Blue Cross
industry,
and Blue
yes.
Shield for
in
a long
fact,
time.
We were on the United Way board together many years
time.
ago.
Yes.
I'm still there. You talk about the situation with these hospitals, and I use privatization only because you're right. It's not a public entity. It's a nonprofit entity, so it's not really public, but it's just an easy term for we in the union movement to understand. But why is it a problem particularly? Is it a problem? And if it is, why is it particularly a problem within the networks going out of network? In other words, does Aetna have a certain list of physicians? Is that the issue?
Aetna, Horizon Blue Cross,
whomever.
any company will have a list of physicians that accept what they will pay
Right.
as their payment in full
Within their network.
within their
So
network.
that's the network, the physicians.
Exactly.
Okay.
Now, hospitals as well, because there are hospital networks. And a hospital, if a patient presents at a hospital will accept what the insurance company pays as payment in full. Now, let's say you go to the hospital and you have a service that costs maybe $56,000. Your insurance company, if that hospital is within its network, might pay them, because this is a hypothetical, I'll say $20,000. That hospital will accept that $20,000, and you only are responsible for a co-payment maybe, or co-insurance maybe, but the remaining $36,000 is written off. If the hospital is not in your insurance company's network, first of all, your insurance company may not pay the entire $20,000. They may pay less than the $20,000
Okay.
because it's not in the network.
And conversely,
The hospital then can bill you for the remainder,
got it. Okay.
and you're responsible for that.
So where does that become, is that particularly a problem within the urban areas? And let's talk about Essex County as an example, or
Well-
the immediate area.
I would say we're seeing this more in urban areas, because in urban areas, many of the hospitals, the nonprofit hospitals that are struggling, are in your urban areas. St. Michael's in Newark, St. Mary's in Passaic, at one time Christ Hospital in Jersey City. These are hospitals that have large populations. They serve large populations. They may have a large charity care population, and as a result of this and many other things, they may be struggling.
Charity care meaning a patient comes in and they have no insurance.
They have no insurance
So-
and no ability to pay.
So the hospital eats.
There is a
they
fund.
bill you, but-
There is a fund that pays some of that, but yes, the hospital receives less.
Right.
Now, because a lot of these hospitals are in urban areas, it seems like an urban area issue. I would not personally call it an urban area issue. It's just occurring in these areas because this is where the hospitals are located.
I look at this area I've been doing this for almost 40 years, but I mean, there was the St. Mary's in Orange. You had Columbus.
Columbus.
It was in
Newark.
Newark.
St. James.
St. James down Neck.
Orange Memorial.
Orange Memorial. Irvington General.
Yes. There have been many that have closed.
Right, right. And I think where my father went in Orange to another hospital in Orange that closed as well. So you have all these closings within and it seems to put the onus upon the few, obviously, that are left, particularly UMD&J.
Now, University Hospital.
Now,
yes.
University Hospital, yeah, with the political switch. So doesn't that decrease the availability of care for people? Doesn't that, and if that were the case, doesn't that have deleterious effects upon the individuals and their families as well as society as a whole
Oh, absolutely.
because of health
Absolutely.
issues?
What we have found, if you look across the country, in fact, you have many not-for-profit hospitals being taken over by for-profit chains. We will probably be talking about one of them a little later, but they're taken over by for-profit chains, and because profitability is the driving factor now rather than the health care, you have issues with possibly inadequacies in staffing, cuts to services, the entire in-network, out-of-network issue. Because services are cut, staffing is cut, of course that's going to affect the community that is very much dependent on this hospital. If you have a hospital that decreases the level of charity care that it does, that will put, especially in the case of Newark, that puts a further burden or a heavier burden on the one other hospital in the area, being University Hospital, if we're talking St. Michael's Medical Center versus University Hospital. We all know that University Hospital has its own issues, so we would certainly hate to have that happen.
Let's go to that company you thought we were going to talk about, which is Prime.
Prime Healthcare
Prime
Services,
Healthcare.
yes.
What about Prime Healthcare?
Prime Healthcare Services is a for-profit hospital company out of California. They have taken over, they've purchased several hospitals across the country, in Kansas, many in California, also in Kansas, in Rhode Island, in Pennsylvania. They attempted to purchase Christ Hospital in Jersey City and were, for lack of a better term, fought back. They are in the process of going through the CN process, Certificate of Need process, with St. Mary's in Passaic. And they have bid on and are the potential buyer for St. Michael's here in Newark, as well as St. Clair's in Morris County.
Now, just as a little background, in 2007, the Los Angeles Times ran a news story about alleged policies of Prime Healthcare that said that, and this is where they're based, that they resulted in higher than average profits at the possible cost of patient care, that when the company, which apparently is owned by a gentleman named Reddy, takes over a hospital, it typically cancels insurance contracts, allowing the hospital to collect steeper, higher reimbursements. It has suspended services such as chemotherapy treatments, mental health care, and birthing centers that patients need, but they're not lucrative to the company. And on 4 occasions, this writes, since 2002, inspectors have found that Prime Healthcare facilities fail to meet minimum safety standards, placing their Medicare funding at risk.
At risk.
Right. So they don't have the best of
History. Yes.
Right.
It should be noted that they have not even completed the CN process, the sale process for St. Mary's. But as soon as the State Health Planning Board recommended that the Department of Health Commissioner, Mary O'Dowd, as soon as that recommendation from the Planning Board came that the sale should continue, insurance companies were notified that they would be canceling contracts, and I believe up to 30 employees lost their jobs at that hospital. This is St. Mary's, and the process isn't even completed yet. So we have a lot of fears about what will happen once the process is complete, and if they should get St. Michael's or St. Clair's or virtually any other hospital in New Jersey.
Apparently that's not unusual. I had a phone conversation, as you know, this morning with some folks, actually the CEO and the president of the United Way, and about our involvement, our board involvement in this issue. It was a good conversation. And one of them indicated that St. James and another hospital apparently had gone through similar processes, and actually everything was done without final approval even having been gotten from the state. You know, like a lot of the processes that, you know, to turn it over to private. I don't know if it was Prime or it was somebody else.
I can tell you it was not Prime.
It wasn't Prime. It was another one. But that's apparently part of the problem is the state really having the type of oversight over these processes that they should?
Well, we don't believe that they are. We have time and time again called for a monitor to be put in place over St. Mary's. St. Mary's does need a buyer. St. Mary's, the community there does need that hospital to stay there. It's the last hospital in that area. We're not asking it to close. Quite frankly, we have not even said Prime cannot be the buyer. We're just saying that the state needs to set up a monitor there to make sure that Prime is staying in network, that it's keeping the hospital up to par as far as services and staffing, that it is reporting in a transparent and proper manner. One of our partners, HPAE, which is the Health Professionals and Allied.
The union.
Yes, the union. They did an extensive report on the laxness of the general oversight of the Department of Health over many of the for-profit hospitals. So
New Jersey Department of Health.
Yes, the New Jersey Department of Health. Thank you. Our concern is that the Department of Health's history is not good in this area. There have been just a lack of oversight. So we feel that a special monitor looking over Prime is absolutely in order.
What about the state's controller? Shouldn't they serve in that capacity, do you think? We used to have an ombudsman, but I think they did away with the ombudsman.
We did away with that, I thought.
Yeah, but we did, the guy just retired, not retired, changed jobs. That was, their Boxer was his name, was a controller for a while. But anyway, another issue is a concern, I believe, is that a company such as Prime, and not just they, but this, could be allowed to buy a St. Michael's, and apparently this has occurred before with them or with some other, and or other companies such as that they would buy the facility, keep it open for an agreed to period of time, like 5 years,
Right.
It seems to be the figure, and then they'll sell it off for development.
Well, after that 5 years, they can sell it. They can sell the land underneath it. They can cut it back to a simple emergency room wherein you go there, you are stabilized, your condition is stabilized, and then you're sent somewhere else. There's any number of things that they could do, and we have seen happen in other instances. Obviously, if you have a full-service hospital that's cut down to simply an emergency room, well, now you've lost a lot of services, not to mention the jobs that were part of the hospital. If they are selling the land underneath it and we don't have transparent reporting in the state regarding those issues, suddenly a lot of the assets from the community, you don't even know what happens to it.
Right, and since they're private, we can't do an open public records request to
Right.
them, and if the state doesn't do adequate oversight, even if we did one to them, they wouldn't have the documentation that we
Exactly.
needed anyway. Another issue is how this type of process leaves the taxpayers on the hook. Why don't you explain what's happening,
Well,
for example,
very
with St.
interesting.
Mary's?
Very interestingly, St. Mary's, the sale price that Prime will be paying for St. Mary's will not cover the loans against the hospital. So I believe the St. Mary's sale will leave taxpayers on the hook for about $30 million.
New Jersey
New Jersey taxpayers,
because
yes.
it was a state that backed up
Yes,
those
because
loans.
the state backed up those loans. St. Michael's, that just redid in the last several years its entire emergency room, they have a sale price which, honestly, I'm not remembering the original number, but I think it was somewhere like 46,000 possibly. But don't quote me on
For a
that.
million.
But I'm sorry, 46 million, yes.
That would be a real bargain.
It has since been cut by Prime to 22 million. The sale price will leave taxpayers, New Jersey taxpayers, on the hook for almost $200 million.
Which is important within the overall context, as if we look briefly at the current, as we're doing this in June of 14, right now there's a big battle over the budget. The governor, and it affects labor in particular, because the governor, for all the years he's been in power, has overestimated the income the state would derive, and done a lot of one-shot fixes, and now wants to divert monies that were determined in 2011 that the state would pay into the public employees pension system, which hadn't been funded, not just to fault the current governor, but by prior governors as well, except for one. Christie Corzine put $1 billion in, but he wants to divert hundreds of millions of dollars from that in order to balance his budget. So we got a whole battle going on there. So in addition to that,
we're going to add over $200 million to
more
the deficit. Yes.
Yeah, But that's on paper though, so that could take time to pay off over time, I assume. But it's still going to be something that's a debt that's going to have to be paid by somebody at some point.
And we haven't even gotten into, we don't even know how much St. Clair's might wind up leaving us, and then if sales such as this are allowed to continue, what the figure could be down the road.
So you have this problem. How is Citizen Action and its affiliates and people that aren't necessarily technically affiliated, such as United Way, what are you doing to try to fight these things?
Well, we have put together a coalition called the Campaign to Protect Community Healthcare. And we have about 15 organizations that are working with us. And one thing that we have been doing is we have been going to elected officials. In fact, in Essex County, we were able to get past resolutions in both the Board of Chosen Freeholders as well as the Newark City Council that basically just called for whoever purchases the hospital to be a good steward, to keep the hospital open, to be a good steward of the services and the staff, to make sure that their reporting is on the up and up, that their coding and their billing and their general business practices are above board. We have elected officials both at the Essex County level and at the municipal level who are behind us. We have been speaking to community organizations to try to get the word out to the public, because all of these sales require public hearings. But one thing about public hearings, if the public doesn't know about them, or if the public doesn't know about the issue, then the public's voice is not heard. You can say you had a public hearing, but if nobody comes, is it really a public hearing? So that is another one of our missions, is to just get the word out. We would also like the Board of St. Michael's to go back to the drawing board. St. Michael's is not in the same situation that St. Mary's is in. St. Mary's has no safety net. St. Michael's is owned by Catholic Health East and Trinity. These companies have money. These companies can certainly keep this hospital open long enough to find a better buyer.
And they took over from the Archdiocese.
They took over St. Michael's. So we are in the process now of getting cards signed that we hope to send, or we will send, to the board. And I actually brought one of them with me.
So we'll give it to Jerry. He can put that up as the show airs.
We will be sending these to the board saying, we don't like this deal. We don't like Prime's history.
St. Michael's Board.
St. Michael's Board, yes. We don't like the deal. We don't like Prime's history. We don't like the amount of money that taxpayers will be left with, and we would like you to go back and do this correctly.
What about the legislature?
We have actually had conversation with the state legislature. Senator Rice, Senator Vitale, I know is very keyed into this. We have spoken to some of the assembly people, and we actually are continuing those meetings now. Yes.
You have some points here, these principles. I guess you've touched on a couple, if not most of them, but there are only 4. And we'll put this up too, Jerry. But you oppose healthcare business models that limit access. That's primary.
Access and affordability
right.
is key, are key.
Okay. You talked about New Jersey standards for approval. In other words, the oversight by the state of New Jersey Department of Health. Okay. And requiring strong standards and enforcement of standards for access and quality care. Now, what does that mean, and by whom would that be done?
Well, that would be done likely by the Department of Health, the New Jersey Department of Health as well. And when we say access, we are concerned that if after 5 years a hospital closes, sold for condos or is stripped down to just an emergency room, there's access to care that is endangered right there. We have examples out in California with Prime Healthcare where cancer services were cut because they were not profitable. And as a result, now those cancer patients have to go elsewhere, sometimes a distance. If you are talking about a population that may not have the means necessarily to just jump in a car and go to a hospital, that could be a problem.
But it's not funny, it's sad, but interesting how many of these things interact when you say Prime cut back on services to cancer patients, again, because it's not as profitable. Also, I think I read birthing and a couple other things.
Yes.
Then you have things kind of compounding each other because of, for example, the administration, the governor's position on medical marijuana and its availability. In fact, I believe recently he came out, I'm paraphrasing greatly, but basically kind of was saying that maybe the programs weren't needed because they were being underutilized, but in fact they weren't rolled out correctly in the first place. It took a long time to get them approved.
If there's no access.
And not only that, but so you have to jump through so many hoops just to get approved. The physicians have to do special, papers and proofs and everything else. These things all
one builds on
impact
the other.
Yeah.
One builds on the other, yes.
Yeah. So what do you need from the general public?
Well, what we would like the general public to do is support your legislators, your local officials as they support us. We would like to get the word out. I would like you to go to our website.
He'll put it up, Jerry.
He will open it up.
Yep.
And contact me. I believe I gave Jerry also my card.
That'll be up on the screen.
They should contact me directly, and I can make sure that they get cards signed. Help us get the word out, mostly, so that legislators, the Department of Health, they hear your voice when the public hearings come, when there are events that some of our partners hold, that they support those, because really all we're trying to do is A, get the word out, and B, protect the affordability and access to care.
What about the clergy? We're wrapping up. We got a minute, but what about the
We have reached out to the clergy, and I will say that one clergy member did. He has a board member, a St. Michael's board member, who is a member of his church, and he did help us get a meeting with this particular board member, and we will be meeting with that person.
Because it seemed particularly within the urban areas, and particularly within the African American community, the churches can play
they can play a huge role.
Getting
and
the word out.
We have reached out to most of the churches in this immediate area. We were a little bit put off because they were somewhat distracted by the mayoral race.
Well, that's
but
over.
Now that it's over,
now we can focus.
Now that it's over, we can focus even more so.
India, Hayes, Larrier, we have to stop focusing because, believe it or not, the show is over. I told you it would go quickly.
You did tell me.
And I thank you very much for coming and being our guest.
Thank you for having me.
And thank you for watching Labor's View. I'm David Weiner, and we hope to see you in future shows.